Blood pressure is the pressure circulating blood exerts on the walls of the arteries. When the heart pumps, this pressure is called the systolic pressure. When the heart relaxes, this pressure is called the diastolic pressure. Systolic pressure is always higher than diastolic pressure. Blood pressure is measured in millimeters of mercury, or mmHg. A blood pressure reading is written like a fraction, with the systolic pressure over the diastolic pressure. It is normal for the blood pressure to vary throughout the day, within a relatively narrow range. Be aware of the range of blood pressures that are considered normal for each of the people in your care. Also, be aware of factors that can cause temporary increases or decreases in the person's blood pressure, such as exercise, emotions, time of day, or a change in position, and report these as well. If you measure a blood pressure that is significantly higher or lower than the person's normal blood pressure, be sure to report this to the nurse. To measure a person's blood pressure, begin by washing your hands and gathering your supplies: a sphygmomanometer with the correct cuff size, a stethoscope, alcohol or antiseptic wipes, and a pen and paper. Follow your preparation steps. Knock, introduce yourself, greet and identify the person, and ensure the person's privacy. Explain what you are there to do and ask permission to continue.
I'm going to check the measurement on your blood pressure. Is that okay?
That's fine.
All right.
Adjust equipment as needed for body mechanics and safety.
How's that, okay?
That's great.
If the person is in the supine position in bed, position the person's arm so that it is resting comfortably, palm up, on the bed. If the person is in a chair, have the person sit with both feet flat on the floor. Position the arm so that it is fully supported and level with the person's heart. Clean the earpieces and diaphragm of the stethoscope with an alcohol or other antiseptic wipe. Discard the wipe in a facility-approved waste container. Turn the screw to the left, down, and squeeze all of the air out of the cuff.
Okay. Now I'm going to put your sleeve up here for you.
Adjust the person's clothing as necessary to expose the upper arm. Locate the person's brachial pulse on the inside of the elbow.
Now time for the...
Place the cuff on the person's arm over bare skin with the arrow directly over the brachial artery. The bottom edge of the cuff should be about 1 inch above the person's elbow. Wrap the cuff around the person's arm snugly and smoothly and secure the cuff. Make sure it is snug enough to stay in place, but not uncomfortably tight.
Perfect.
Place your fingers on the person's radial pulse on the wrist. Turn the screw to the right so that the cuff inflates when you pump the bulb. Inflate the cuff by pumping the bulb until you can no longer feel the radial pulse. Look at the gauge and note the reading, which is an estimate of the systolic pressure. Let the air out of the cuff quickly by turning the valve to the left. Put the earpieces in your ears with the tips facing forward toward your nose. Place the diaphragm of the stethoscope firmly over the person's brachial pulse. Turn the screw to the right or up and pump the bulb to inflate the cuff to 30 millimeters of mercury above the estimated systolic blood pressure. You should no longer be able to hear the pulse. Turn the screw to the left or down and let the air out of the cuff slowly to about 2 to 4 millimeters of mercury per second. The reading when you first hear the sound is the systolic pressure. Remember this number and continue letting the air out slowly. The reading when the pulse sound stops is the diastolic pressure. Remember this number and quickly let out the rest of the air.
Excellent, Mr. Green. It's right where it normally is.
Oh, good.
Remove the cuff from the person's arm.
Okay, now I better write this down before I forget it.
Write down the person's name, the time, and the blood pressure measurement. Follow your completion steps and ensure the person's comfort and good body alignment.
There you go. Would you like the head of your bed raised again?
Yes, I would.
Okay.
Clean up your work area, wash your hands, and report and record.
Is that feeling all right?
It's feeling good.
Good. You tell me when to stop, okay?
Okay.